I want to welcome everyone to the 2015 edition of the SU Research Day and Innovation Showcase. This is our third annual edition of this particular event. We appreciate everyone being here. Special thanks to our provost, Dr. Diane Allen, who is on her way here from a meeting at the system office, so she should be here, she said, in probably 15 or 20 minutes. So special thanks to Dr. Allen and the rest of the exec staff and the president, Dr. Janet Dudley-Eschbach, for her support of this event and research and scholarship on this campus. We really appreciate everything that they do for us. Our first faculty presenter is Kim Van Vulpen from the Department of Social Work. The title of her talk is Addressing School-Based Behavior Health Needs of Children, Bringing Everyone to the Table. Thank you.
Hi everyone, how are you doing? It's good. It's great to be here and to share a little bit about my research. Actually, I was thinking as I was preparing for today, I thought about my beginning undergraduate career, and as a student, I was an elementary ed major. And I remember getting so far as doing my student observations, and I was observing a student in a third grade class. I was helping a teacher in a third grade class, and there was this one little boy throughout the weeks that clearly shined in a way that sometimes is troublesome. You know, behavior issues, frustration, anger, aggression, not doing his homework. And I remember how patient that third grade teacher was, and how she tried to guide him and encourage him. And I remember one time she moved him to the front of the class, and he, just out of defiance, put his chin in his hands and turned the paper over and did nothing of the assignment. And I walked up to him a little bit later. I was walking around, and I walked up to him and just touched his shoulder and kind of knelt down, and I said, "Hey, what's going on? You know this. We've been practicing it." And he started crying. And throughout the weeks, the teacher and I talked about the situation, and throughout the weeks, we began to realize that this little guy was having much more issues than just coming and getting his homework done. There were some emotional family issues as well that was really preventing him from reaching what he could reach. And it was at that time that I kind of went, social work my career, took a class and knew that that was where my home was. So my clinical career actually has led me in different areas and with different populations. So this is kind of a full circle moment where I can now come back and research and share and disseminate some knowledge based on the social problem that brought me to my field of social work in the first place. So it's really good to talk with you about what I'm doing and how our fields sometimes are very much connected. So just a little bit about the prevalence of mental health disorders in children. And we'll realize just how common it is. 20% of children in the United States have a serious mental health disorder. 13% of children ages 8 to 15. 1/2 of the individuals with a chronic mental health challenges are usually diagnosed or have onset by the age of 14, and 3/4 by the age of 24. So we see a significant amount of children starting to have symptoms early on in their childhood. In Maryland, it's predicted that around 62,000 children live with serious mental disorders in our state. So just like the little boy in the third grade class, we saw that the mental health disorders and issues that are going untreated impact them behaviorally, socially, emotionally, and educationally. We see this through disruptive behavior, classroom attendance, issues around anxiety and aggression and bullying. The problem is that 70% of school-age children with mental disorders do not get or do not seek any treatment. So it is a population that is really going untreated in our society. 50% of the school dropout rate for children 14 and older who are receiving special education. That's a significant percentage of dropout rate. And suicide is the leading cause of death in teens. And so just in Maryland in 2007 and 2010, it was around 300 teen suicides, and we have the breakdown of what the age range was. So we see that, we would think that between the ages of 10 and 14, the younger ages, we wouldn't see that as frequently, but we are. So we're seeing that 17 or 6% were from in the ages of 10 to 14. 100 children were 15 to 19, and then 178, we see a drop between the ages of 20 to 24. So this is identifying that transitional age youth also are needing some attention as well. So I can't really talk about this research without talking about a program that is out in our community who was the original group that contacted our university for a partnership. And it's the Eastern Shore School Mental Health Coalition. And school-based mental health started to get some attention when there was some reports coming out by the U.S. Surgeon General's report on mental health. And then there was the National Institute of Mental Health in 2001 put out a blueprint for action on addressing mental health and getting evidence-based practices for treating these children, whether it be in the schools or whether it be in the community, but finding ways to address these problems early. But in 2009, a report by the Maryland Steering Committee of Students with Emotional Disabilities came out and identified that these children were not being reached, and especially on the Eastern Shore. A large percentage of those children, even more so, were not being reached. And so the Eastern Shore was actually pretty high in that gap. So what the coalition did, there was a group of key people that got together from the 9 counties, and literally when you hear their story, they got together at Ruby Tuesdays, and on a napkin, the Eastern Shore School-Based Mental Health Coalition was formed. They talked about the needs, and they talked about what each of the disciplines could do, and how could this be addressed on the Eastern Shore. And so they said, we understand the pressures of the school districts, but we need to be able to start to get them services, get them funding, get education to them. And so out of that, the 9 Eastern Shore counties, the Maryland Coalition of Families, the Talbot County of Mental Health, the Mental Hygiene Administration, University of Maryland, Chesapeake College, all became part of this mental health coalition. And I know I'm leaving out a few, Family Navigators, schools, core service agencies as well was part of this coalition. And they identified that their role was to provide resources and to disseminate knowledge wherever that needed to be, and then focus on workforce development, mental health, but also educating the teachers and the other personnel in the schools. So that's when the coalition has been working, and they've received a grant through the Maryland State Department of Education, and they reached out to Salisbury University, our social work department, and they said Salisbury University is a rural university. It would be familiar with many of the counties on the Eastern Shore, and we would like you to work with us to conduct a needs assessment, to disseminate the knowledge, provide trainings, really connect with teacher education, and at some point focus on curriculum development, and start with some strategic planning based on the needs assessment. It's pretty clear as to what the benefits of school-based mental health is. The studies are showing that there are some benefits, or so many benefits, to providing these services. One, it decreases logistical barriers. It gives children greater access. If you think about it, this is the environment where we have access to all the children and possibly can reach them and identify them earlier. It's also reducing stigma. So if they're seeing the school counselor, that might be less of a stigma than going and reaching out to a community-based provider or a mental health counselor. We also know that children who have participated in school-based mental health have improved school performance. they have improved behavior and improved self-esteem and efficacy. So the evidence is there that these services are beneficial. We just need to understand why they're not being implemented, how can we navigate those barriers, and then that's where my role comes in my research here at the university in our social work department. So we know that we could not look at this just from one perspective, that we needed to look at it from a holistic view. And so we started planning the research and we said, let's look at it from different lenses. Let's look at it from a lens of community-based providers, providers that are out in the community seeing these children, getting their feedback. Let's look at it through the teachers, which is not on this circle and should be, the education system. And school-based personnel as well. We also need to maybe reach out to some key informants, and then parents and guardians. So today I'm just going to be talking about the first three because we see we're taking a multi-pronged approach in looking at this. We've conducted the school-based survey. We've conducted the community-based survey. We have worked with the focus groups and the key informant personnels. Our parent and guardian survey, I checked it this morning. It's open till October 15th. There's already 300 parents who have responded to the survey, so we're really excited about those results. And then in the spring, we hope to focus on transitional age youth and really implement, begin to understand their specific needs as they're transitioning into adulthood. So some of the key questions that we wanted to know were, one, what are the school-based mental health needs on the Eastern Shore? We know across the country some of the needs, but is the Eastern Shore a little different? What are the professional training needs? What do the teachers, what do the staff, what do the counselors need? What do the school nurses need? What are the barriers to implementing those services? And what are the needs identified by the parents or guardians? And what we're hoping to see is that these themes come together and we can see it from the many different perspectives of all the people involved. So what we did was we found a survey that was done out of Missouri, Reinke et al., and we kind of adapted her survey or modified her survey with her permission to address specifically what we were wanting to see and then the area of the Eastern Shore. So our community healthcare providers, or community-based provider survey was 184 respondents. The school-based, we had 217 respondents. And the key informant focus groups, we held 5 focus groups, and they ranged between probably 12 to 15 participants in each group. The general findings that we identified was, we kind of thought, will there be some discrepancy whether school-based personnel says this is where mental health can be taken care of, or do they say that's not our job? And we see that 79% of the school-based personnel said, yes, schools should be involved in addressing these mental health needs. The community-based was a little bit more, 86%, but similar enough. The mental health issues of students impact other children in the classroom. Sometimes we're just focusing on the needs of the child who has the mental health challenges, but we also need to focus on the impact of the children that are sitting in the classroom with them. And pretty much 94% of the school-based providers and 95% of the community-based providers felt the same way. 78% of the school-based respondents believe that they can play a role in ensuring the mental health needs of students are addressed in a timely manner. This surprised me, and it was refreshing because, the schools are busy. The schools have a lot of responsibilities as it is, but they still say we're responsible. And they're ready to be team players in this. And this is really good to see for those of us that are wanting to implement services. But if you see, the confidence level drops a bit. 32% of the school-based respondents said, we have the adequate resources to address it. They want to address it, but the confidence that they have the resources is a lot less. So the top challenges that the school-based personnel said they faced was that student behavior was the biggest one, 26%. Then juggling the time and the workload. Some of the themes we heard was teaching to the curriculum and getting the paperwork done. Family involvement and home challenges, resources and funding, lack of staffing, mental health needs, staff knowledge needs. Lack of administrative support was pretty low, 3%. So they feel like they're supported in the schools. It's just some of the resources aren't there. Teaching the curriculum was the theme, truancy, space. Some of the respondents talked about, it's not very conducive to do counseling in a broom closet because that's all the space we have, or in a hallway. And there were some other reasons as well, 2%. So if we look at their training and skills, we see that 31% and 48% said substantial to moderate training in using behavioral interventions. This was pretty clear. Even though they were saying that addressing behavioral interventions was some of their largest challenges, they did say that they are pretty trained in using those interventions. However, we see that confidence again drop when we're talking about skills for addressing mental health needs. So we see about 27% either disagreed or strongly disagreed that they had those skills. But we see it even more so in the teachers. I pulled out just the teachers' responses, and 38% of those teachers strongly disagreed or disagreed, and 34.5% were not sure. And so this is saying, hey, we know these mental health needs are in our schools. I don't know how to address them, and I don't have the confidence to address them. One of the questions we asked them is, what kind of issues are you working with every day? 99.4% said strongly agreed or agreed that, yes, I'm working with defiant behavior. Disruptive behaviors or acting out, problems with inattention, family stresses was one of the higher ones, which I thought was quite interesting. The teachers and the school-based personnel are seeing that family issues are coming into the classroom. Anxiety problems and aggressive behaviors. And I just pulled out the ones that were above 90%. There were tons in the 80%. Our school-based staff are challenged with issues on a daily basis, and that's in addition to them trying to teach. So the most concerning mental health issues, they were across the board. There were tons of them. ADHD was some, behavior, depression, family and home issues, anxiety, anger, self-harm, autism and bullying, and just lack of treatment follow-up. But I think this is when our eyes start to open. We know that the schools and the communities are very dedicated in working with these children, getting them the services they need, but they've identified there's some barriers for children to receive services. One, and I've set it up so it's a comparison of the school-based study and with the community-based study. So we see that the parenting programs, 76% of the school-based versus 83% of the community-based. Behavioral prevention programs, staff training or coaching, ongoing monitoring, crisis planning, or early screening and pre-referral programs. So we see the top ones pretty much in comparison, some of them about a little 10% more in the community-based, but we're seeing common themes. And this was one of the reasons why we were looking at the different pronged approach, because we wanted to see, is the perceptions of school-based similar to those in the community? Because the reality is it's those in the community that are sometimes applying for the grants, who are speaking to legislature and really advocating for funding in the schools. We also looked at external factors that are of children falling through the cracks. Mental health issues in their household. So this isn't just them, this is their families. And poverty, substance abuse, parental incarceration, and lack of transportation. These were all identified by both surveys as barriers and why children are falling through the cracks in our counties. So some general themes from the focus groups that we conducted, again, very similar. Barriers, insufficient school mental health professionals. It was a very strong theme of saying we need more trained mental health professionals in the school systems. Lack of funding, which goes into hiring, and getting parental consent, getting their involvement. It's a team approach, and we need the parents sign in their support to really get these children identified, assessed, and receiving treatment. And then just overall training for the mental health counselors, but also training for all the school-based and educational providers as well. So barriers for families in seeking services. In the perceptions of these two studies, the community-based and the key informants, the stigma. And we think that the stigma is actually something even more so on the Eastern Shore with smaller communities and not understanding what mental health issues mean and really getting that and addressing that stigma. Lack of knowledge, transportation. We do not have a strong public transportation in our counties. And it's not as if a child can just, and their parent can just get on the bus to go seek mental health counseling. Insurance, and just general lack of trust. So I pulled this out because I thought this was pretty interesting as well. And this is the school-based survey focusing on whether they feel they can access training. And they're pretty consistent, with the classroom behavior management and also just general training for staff. So we see that 38 strongly or disagree and 10% strongly disagree that they can easily access. That's 48% of the school-based personnel that feel that they can't easily access any kind of trainings. It's 43% who strongly agree or strongly disagree that they can easily access behavioral interventions and training as well. They want to know know how to handle classroom behaviors. They want to know about mental health first aid, and they want to know about specific diagnoses. Many of them said, I want to know what it means to be working with a child who has severe anxiety or a child who has severe depression. I want to know specifically about those diagnoses. They wanted to know about enlisting support, how to develop teamwork, and just general child development. Sometimes in normal child development, we say, oh, this is a little off, and then we realize it's just normal development. But the teachers want to know that as well for early identification. The themes for the focus group talked about lack of family involvement, limited child mental health specialists on the Eastern Shore. We have very few to refer to. And lack of teacher training, transportation, and limited specialized services. And the unmet needs for the children on the shore. Again, just limited service. So we're seeing themes throughout. Limited services, transportation, parental involvement, child specializations with a child mental health specialist. The themes in the focus groups talked about the lack of educational mental health needs for school staff, the collaborative barriers. Education, Common Core makes it difficult to meet for therapy to take the child out of the classroom. There's only certain times that the kids can be taken out of the classroom to see the therapist or the counselor. Time. When working in partnerships with school, it's difficult to balance school requirements with time needed to provide services. And role constraints. Teachers want to teach. They are not behavioral health specialists. Now, that's just one statement that we thought we would see more consistently, but I think deep down, all the school-based personnel are dedicated in addressing these issues. Other barriers, Barrier to see client, to make barriers in seeing client, to make the budget, not getting paid to collaborate, and we know that collaboration is the key. Collaboration is not billable, and so sometimes that does not make it feasible for mental health specialties to see the child in the school. They talked about space, physical space. There's no space for the classes, and there's even less space for mental health services. Scheduling. Everybody's possessive of the time. They need to get things done. There's just not enough time in the day. And then stigma. Teachers do not want to talk about children's needs in a group as they are seen as incompetent. And I thought this was interesting. The teachers thought possibly they might be a failure if they're not able to take care of these their own students in their classroom. And that shouldn't be the case at all. So some of additional thoughts from respondents was we need more programs addressing the mental health of young children. Early intervention is where there will be the biggest impact, as these children are still impressionable and are willing to try to improve their lifestyle. The stigma surrounding mental health issues must be eliminated. Parental education and involvement is critical at the elementary level. And then lastly, there are many classroom teachers who do not know how to deal with these students and who struggle with extreme anxiety. So what are the next steps? One of the things that we did see was that, we're seeing common themes. And this is very helpful as we're coming to the table, again, to develop a strategic plan. These results will be disseminated at one of the superintendent's meetings, where all the superintendents on the shore get together before the budget planning so that they know maybe they can include some planning on this part. Again, we're currently doing the parental and guardian survey, so we hope to find additional information. We are planning trainings. We held a training here in last April, and we're planning more trainings in November and then in the spring. And then we're going to be looking again at the transitional age youth. We think that some of their issues might be a little bit different, and we want to be able to address across the childhood span. So those are the next steps. Are there any questions? Oh. I'm going to give you a...
Have you had a chance, or are you thinking of looking at what other states or counties or even other countries, what they do to bring these resources in? I mean, I know you've done a lot, but...
I think probably since it's been since early 2000 that states are looking at this because they see this as an avenue. I think most of the states are facing these same challenges. And, one, we want to just address right now the Lower East or the Eastern Shore needs. But I do think that this is something that needs to be looked at in Maryland and across the country. So hopefully we were invited to speak about this at a national conference so as well. Any other questions? Thank you very much.
Thank you all for coming out to the faculty presentation component of today's activities. We sure appreciate the energy from all four of our great speakers. They represented each of the schools in outstanding fashion. Thank you all for attending. We look forward to having you at next year's event, and please join us in the atrium for the showcase component of today's activities.